NBC5 Investigates has been following Chicago's migrant crisis for months now.
Medical volunteers tell us they've run into hurdles when trying to offer more medical care at these shelters. NBC5's Bennett Haeberle is joining us now with a closer look at Chicago shelters. Bennett?
Alex and Allison, the volunteers tell us that their offers to provide medical assistance have up until now been turned down. It was something the mayor told us he was unaware of. Another ambulance run Monday to the Halstead shelter, where more than 2,000 migrants are staying. Over the weekend, a 5-year-old boy was found unresponsive here and later died. Chicago Fire confirms there have been several calls for sick children at this shelter.
But we have lots and lots of produce.
The news of the child's death was not surprising for Dr. Evelyn Figueroa, a physician and medical volunteer who also operates the Pilsen food pantry. She told us migrants have shown up here asking for food, clothing, and medicine.
I expected there to be some atrocity in the building, and that would finally give us the leverage.
Dr. Figueroa tells us a medical student volunteer was allowed to visit the shelter Monday after previous requests have been ignored.
It shouldn't take people dying for you to do something, for you to ask for help. Help that's readily available, and people are offering to help.
Speaking at a city event, Mayor Brandon Johnson said he was deeply sorry and hurt about the child's death, but defended the city's efforts.
They're showing up sick. Do you hear me? They're showing up sick. The issue is not just how we respond in the city of Chicago.
There have been a number of ambulances. We attempted to ask the mayor about what the volunteers told us. It's led people to tell us that the medical care being provided at this site is inadequate. Can you respond to that criticism?
So there are volunteers that want to provide medical assistance?
That's right. And they're saying that they've repeatedly...
Are these, hold on a second, are these medically trained volunteers?
Yes.
Okay, I'm not aware of any medical volunteers that want to go into sites to provide medical care. I'm not aware of that.
For months, volunteers with the Migrant Mobile Health Team, made up of medical student volunteers, have provided assessments and coordinated medical care for migrants at Chicago police stations. Their organization even spoke before City Council in October, detailing the hurdles they say they've encountered. NBC5 Investigates obtained this text message from November 25th between a medical volunteer and the city's contractor, Favorite Healthcare Staffing. In it, the volunteer asks if they'll be moved to triage at the shelters once the police stations are cleared. The response, at this time, we don't believe we will need help in the shelters. We had some follow-up questions to the mayor's office, but we have not heard back this afternoon. The mayor repeated during his Q&A that the migrants are showing up here again sick. He blamed the Texas governor for sending scores of people to Chicago. The health department, meanwhile, says the cause of death for that child remains unclear, but they are aware of cases of chickenpox at that specific shelter location.
Hopefully raising these questions, though, might get more information to the mayor to maybe make different decisions when it comes to medical care.
Well, and I know that there are medical teams that do provide care at those shelters, but there seems to be sort of a question about, why can't these volunteers get in there and assess this and provide assistance that seems to be needed?
Yeah. All right. I know you'll stay on it.
Sure.
Thank you, Bennett.